welcome to everybody to joining us for this webinar on mainstreaming effective post-incident support. It's an opportunity for an interesting discussion on this topic, as well as an opportunity to launch Steve's new venture on proper support and the non-profit entity that goes along with it, the Proper Support Trust. My name is Lisa Reilly. I worked for many years as the Executive Director of GISF, the Global Interagency Security Forum, and I now work as a consultant supporting organizations to improve their security risk management and the mental well-being of their staff, as well as having a small private practice working as a therapist. As a trustee of the Support Trust, I'm very happy that Steve asked me to support this event and chair this discussion. The topic of effective support is really very important to me, and I see the relevance of it in my journey from engineer to therapist and consultant, where I am now. I've seen firsthand, as well as had very personal experience, of the difference receiving the right support at the right time can make. So really looking forward to the discussion we can have this afternoon. As always with these events, there are some house rules. I'm very pleased to see so many of you have your cameras on, and if you can leave your cameras on or put them on, that's great. It's really nice not to be talking into a black hole. If you can keep your mics on mute, that would be great, unless you are invited to speak, of course. As you've seen, we are recording this event and it will be made available afterwards, probably on a YouTube, but we'll distribute the link to everybody who's registered. There will be opportunities for chat, for questions, hopefully as we go through. If you have any, do put them in the chat, and if we don't get to them, we will provide answers in the future. Megan is here somewhere. Megan can wave. If you have any technical issues, do reach out to Megan in the chat and she will try and help you. One of the downsides of doing this as an online event is we don't have the coffee afterwards for everybody to gather and have a chat. So while we will finish the formal webinar on the hour as planned, Steve, myself and the speakers are around to stay for a short while for anybody who has further questions or anything that they would like to discuss further. We'll do that informally after the end of the webinar. And just finally, we will be raising some quite difficult topics that may trigger people. So do be aware of your own self-care needs. And if there is anything that worries you, reach out to one of us or your normal support personnel. So I think hopefully I've covered all the rules and regulations and the introduction. So what I'd like to do now is hand you over to Steve, and he'll tell you a bit more about why he's launching this initiative. I'm sure most of you who are here know Steve Dennis, and I think also know the difference that he has made to the duty of care discussion within the humanitarian sector through his willingness to take his former employer to court and the positive verdict that he gained, which is really a game changer in the sector. If you want to know a bit more about him, his bio is in the chat. So on that note, over to you, Steve.
Thank you, Lisa. It's the expectation of every aid worker when we deploy into difficult areas, these are disasters and war zones, that we come home safely. As we know in the news, almost every day we see that that's not the case. Even though the majority of people do come home safely, many, like hundreds in a year, come back injured after a kidnapping, or the remains come when there's a fatality. The headlines kind of taper off at that point, and that's the point of this discussion. Thank you all for coming today, for joining us in this conversation of what happens afterwards, post-incident. We've got a good panel of people here, and this is a great and relevant conversation. I think it's a neglected area, and first, to start us off, I'd like to show a video. I interviewed somebody who had a great introduction back after a very difficult kidnapping. He was taken hostage, and he describes it best, what good support looks like post-incident after all the headlines have petered away. When you're listening to the video, just hear in his voice his appreciation for things that might have cost money or not cost any money, just considerations that really helped him along the way, that somebody put some concentrated thought to, and that type of approach is, I think, what we need to be mainstreaming today. So I guess, yeah, once we get that video going, it is somebody describing what I would consider a gold level support after an incident. We'll leave that there, but as many of you know, I went through a kidnap incident myself. I was attacked and shot and kidnapped. Fortunately, I got out in some days, but it was highly traumatic. I was diagnosed with PTSD and depression afterwards. The support that I got was insufficient, and this became a dispute that went to court, and through that court verdict that was in favor of gross negligence against the organization, it got quite public. And a lot of people reached out for support in their own recovery after their own complicated and traumatic injuries. So I started working with people about that. And so far, I'm almost up to 50 people that I've worked with, working on their recovery process. This has really highlighted to me that there are gaps. There are huge gaps in the understanding and implementation of what one's duty of care is after an incident. There's a lot of attention before the incident to try to reduce risk, but then after the incident, there's an equal amount of risk to support somebody fully or to drop them. And so that's become my work, and that's the focus of this discussion here. So maybe back to you, Lisa. Yeah, how do you want to play this?
I think my suggestion is that we move on to the Q&A, or the panel discussion really, and bring in our guests, Christine and Imogen. And very happy that they are able to join us today for this discussion. Christine is the founder and lead consultant at Duty of Care International. I worked with Christine for many years, and I was at GISF, as Christine comes from an HR background, so really working together to try and break down those silos between HR and security. And our other guest is Imogen Wall. She's the founder of IW Response Associates. She had an interesting and varied career, shall we say, across the humanitarian sector. And she now works supporting organisations to manage psychological risks. So welcome both to Christine and Imogen. And as usual, their bios are in the chat if you'd like to find out a little bit more about them. So I'll start with a question to you, Christine. As I say this, if you do have any questions for the panel, do please add them into the chat. And if we have time, we will try and answer them. So Christine, the topic of the webinar is about effective post-incident support. So what does that mean to you?
Yeah, thank you. And welcome everyone. It's an absolute pleasure to be here on this panel. Post-incident support, when I naturally from an HR and duty of care background, I think of well, the incident's happened, someone's been harmed, so we need to ensure it doesn't get any worse. So our duty of care is to not make things worse. So that's the first thing, as Steve has rightly pointed out. But to me, effective post-incident support is about delivering this timely, well-rounded care that takes into account both the medical and psychological needs of the person affected. So it also involves having experienced staff who can provide that personalized support, maintain clear communication, and create a recovery process where individuals feel safe, supported, and truly valued. And all of that supported by the organisation's own systems, strategies, and resources. It's quite a lot there, but essentially that's what we're talking about. That's what I see.
That's brilliant. Thank you very much, Christine. I'd like to ask the same question to you, Imogen. What does effective post-incident support mean to you?
It's a good question, and I think you made me sound a lot more exciting than I am, incidentally, in my introduction.
Yeah.
But I have done a lot of stuff. Before I did, now a therapist and a mental health first aid instructor. But before I did that, I was the person on the plane. I was the person who was deployed. Nothing to do with mental health. I went in as part of UN missions to crisis situations. And I think incidents do happen. Christine's right. They're relatively rare, and they can be managed well. I think where I come from these days is actually really, really basic place. To me, I'm coming at it from mental health, psychological risk management perspective. The most common complaint I hear from people who've been through stuff and feel they haven't been treated well is no one asked if I was okay. And I particularly hear that from senior staff who are often in charge themselves of managing other people, and everyone's worried about people lower down the food chain, but no one asks the person who's actually managing the crisis if they're all right, how they're doing. And that they're missing those 3 words in a text message or on a phone call, that really sticks. So that to me is a lot of this said there's lots of technical side to this. Lisa, you wrote a brilliant blog the other day on something that's really close to my heart, which is proper insurance policies. So as an organization, you're actually covered. You know someone's going to get the care they need because it's not cheap. And if it's not in place, you're not going to want to find the budget for it, and it won't be in one of your budget lines. So because security budgets don't cover it. So get the insurance in place. But honestly, it's really basic stuff. And the mental health first aid I teach, that's what a lot of it is about. It's about making sure the first time someone discloses or talks about what happened to them actually is possibly the most critical point of all. When I was running 50 Shades of Aid, I got a lot of informal conversations with people, as Steve knows. It is that I've tried to find an evidence base for this, and I can't find it, but I tell you, the anecdotal experience suggests that the cases in which someone ends up in a protracted HR or conflict with their organization about how they were managed, how they were supported, the damage that was done, are the cases in which the first conversation they had about what happened to them was interrogative, was judgmental, was doubting, or was critical. So actually meeting people with kindness and respect and acceptance, what we call the survivor-centered approach, when they first talk about when they come out of an incident, there is data that suggests that increases the chance that they will achieve what is called post-traumatic growth, which you'll know all about, Lisa, as a therapist. Forcing people to talk is counterproductive, but so is not offering them any space at all. I'm really sad we missed that video because I'm always on the market for best practice. At the other end of the scale, I'm working with a client, or have worked with a client, and she's given me permission to share this story. She went through a very complex evacuation in which it appeared halfway through that the organization in question didn't actually have an evacuation plan at all. And this is a major international agency. After it was over and she was safely brought home, the only formal acknowledgement she ever got from her organization about what happened was a request from the IT department for a written report on why she couldn't return her laptop. That was it. So when we talk about this kind of elaborate best practice, honestly, a lot of it is really, really basic. Have a lessons learned, have a process in which people get to have somebody witness what they've been through, and they get to say what they need to say to the organization. It's not very complicated or technical, or in fact expensive, but it is about a mentality. I'm going to stop there because I could talk about this for hours.
That's great. Thank you very much, Imogen. And it really brings to mind one of the very first conversations we had with the security cadre around this discussion. And we had a therapist giving a presentation, and this has always stuck with me. She said, it's one thing to talk about duty of care, but don't forget we have a duty of caring. And I think that's something that we often forget. And as you were talking about kindness, that really came to mind. Christine, I don't want to say how many years you've been working in this.
I don't, please. I think I still got blonde hair.
What changes have you seen over this time? Because things have changed and there are definite improvements.
Yeah.
Where are the biggest gaps?
Yeah, I've seen, I think, certainly since Steve's case, we've seen a positive shift, definitely, in the aid sectors, particularly around duty of care. And as Steve says rightly, there's a lot that's been thrown at the prevention piece. And that's where a lot of the focus has been. And maybe it's because it's the thing that we can understand more. I think the mental health piece has come later. And I think it's just taken so long to fully understand it. And as we know, duty of care isn't just about ensuring someone's safe, it's that prioritizing their mental health as well. So what I do see is a lot of front end training on resilience and how, the vulnerability piece and how to keep yourself safe. But the vulnerability doesn't transpire into talking to somebody, having someone at the end of the phone. And as Imogen has said, is, are you okay? I think sometimes people are too scared to ask even that question, if I'm honest. I think there's a massive growing understanding of duty of care. I do feel it's been sort of heading into the risk area a little more. I feel that we have embraced risk assessment, support systems, and so on. But the gaps you asked me, for me, I often see, because I work with a lot of organisations on duty of care, and I also work a lot in the area of safeguarding now and sexual exploitation and abuse, and putting in those sort of practices around survivor-centred. But what I don't see is experienced people leading this care. And when I say experienced people, I'm talking about people that have the decision-making ability or the authority even to make decisions that they think, hang on a minute. Because often when I've led evacuations, when I've led trying to get people out, people that have been injured, people who have actually died, and liaising with families, the thing that I valued the most was, I was quite senior, so I was able to make decisions as I, say, let's pay for that, let's do this, let's make sure, let's phone these people, it is a lot of it sometimes is instinct. There is no one incident response that I can honestly say looks the same. So the experience comes through. So having that trusted person, so never underestimate someone who is really, really good at their role and understands all of the systems and how they can pull all the resources together. Another area I feel, and this comes into this whole "are you okay" question potentially, is the cultural barriers that we see. We often don't see aid workers asking for help. We don't know, there's lots of reasons for that. But just guiding perhaps someone, sorry about the cat, guiding someone through their recovery and experience and having that complete and total empathy with them, believing them, trusting them, all of it is so, so important. And I think cultural barriers may play a role in that. Limited resources, can't go on about that enough. We've touched on insurance here, but my experience, I used to run all the insurances for a couple of NGOs. Insurances don't cover everything. They won't cover everything. You need, if you can stress test with your insurer some of the eventualities, that's great. And we did do that in one of the organizations I work with. But on the whole, insurance doesn't. So you need to think about that as well. And that comes through experience. And lastly, I just think there's perhaps a lack of appreciation of what it means to prevent further risk at a level where comprehensive systems and practices and tools have already been put in place to help with that situation. Again, coming back to, we focus on the prevention piece. So what are we doing to understand the clear cost benefit? Sorry to do very strategic here, but all the analysis around how do you understand that actually it's really worth putting resources into this. I just feel that we're not doing that well. I don't think perhaps leadership are motivated enough to understand it because they don't understand what that analysis is. So that's probably what I see, those 3 or 4 things the most. They're the gaps I see the most.
Brilliant. Thank you, Christine. And short question to you, Imogen. We'll see. If we get a short answer.
Yeah, I sit here listening to Christine frantically scribbling notes, going, can't see that, need to say this.
But
there's a balance. I want to say this. I think there has massive awareness. I mean, what Steve did, it changed. HR teams had to sit up and take notice. Reputation management aspects, and let's not pretend organizations don't pay a lot of attention to reputation management. They had to pay attention, and people felt able to come forward. So it's very difficult to measure the impact of that, but certainly at 50 Shades of 8 we saw it, people suddenly feeling able to say, I'm not okay. Let's not underestimate the stigma in this sector. Saying I'm not okay is still regarded as tantamount to saying I'm a bad humanitarian, rather than I'm a human being who just went through something horrific, and guess what, I'm having a reaction to that. There's a lot more conversation. I think COVID has a lot to contribute here as well, actually, not just what's happened in the sector, but it really opened up a space for talking about mental health. Short answer for me on the gaps, I think there is still a perception that the psychological risk management is best left to the professionals and is best left to people who are sort of qualified therapists. I categorically disagree. I think there is a huge amount everybody can do. A little bit of basic training goes a really long way, and you don't have to be a internationally qualified therapist to say, are you okay? And to remember to say that. So I see organizations get a bad rap. I see a lot of managers who really care about their staff, but they're terrified of getting it wrong. They're saying the wrong thing, of handling something badly. And again, a little bit of training I delivers confidence. That's what you're looking for. You want to make people feel like they can take on these issues. Big gap for me, big word, and I'm sorry, it's a triggering word. I'm going to say it, but it's suicide. Steve talked earlier about the data that is available on people who are kidnapped, people who are killed, people who are involved in incidents. We have all that. There is literally no data whatsoever on people in our sector who take their own lives. I've never seen it. I've never seen anyone try to collect it. I know of 3 organizations in the last 2 years who've lost a staff member this way, and it absolutely floors the organization, as well as being a tragedy for the person concerned. I've had people come on my trainings specifically because they've had to deal with that situation and realize they're totally ill-equipped. And I want to put a shout out at this point to Ben Porter. Where are you, Ben? Who's on this call, I think, because Thrive have done some great work on this. It was World Suicide Prevention Day 2 days ago, and Thrive put out some really helpful resources. And I think Conterra either have published or about to publish some. But to me, Ben, I don't know if you want to say anything at this point, but this is a massively under-discussed, in fact, completely non-discussed topic in our field, and it is very connected to incident management.
Great, thank you very much, and thank you for bringing the difficult topic to the table. And just to reiterate what I said earlier, do please be careful of yourselves here if there's anything triggering. And be mindful of anything that might be impacting you. But I think some really important points brought out by both Imogen and Christine And I think really what's surfacing for me here is this trying to find the balance between looking after the individual and managing the organization, or the organization stepping up. And I think we often see support focused at the individual taking responsibility, rather than changing systems within the organizations. And I think finding that balance between what was mentioned, personalized support. It's not one size fits all. It's not about just creating a tick box within the organization, but building the expertise that was mentioned, being able to provide a space that allows these difficult conversations to be had. And, you know, as both of you have brought up, that idea of just giving people the confidence to say, how are you? And showing that you care. I understand we now have the video lined up to play. So I'm going to hand back to Steve, and hopefully he's going to carry on the conversation, starting with the presentation of the video that we just missed before.
Good stuff. Just 1 second before you start that, Megan. Just building on that point, Imogen, you made a point that has to be emphasized completely. There's so much attention on preventing a risk or managing a crisis, but I believe that attention falls off. And I would say a large percent of my clients, or a reasonable representation, I've feared that suicide might be the way things end for them. And as security managers trying to keep people safe, as managers, as peers, it's not until they're released from the captivity or they get home, there's that other part that is very much part of it. So I'm glad you brought that up. Let's keep going. Megan, yeah, if you've got it going, let's hear what this person says.
What was especially good for me is when I was at the airport, there were actually representatives from my organization that were there. There was family support for my family. They were all there. The general director was there. A psychologist was there. It was very good to get some briefings from our psychologist on how what I could expect in terms of also body chemistry and all these reactions, going through different stages of recovery and so on. It was really extremely informative for me. And I particularly appreciate also that they were not, it was not like I was being treated as a sick person, but more as a, hey, we have some resources here for you. And if you would like to take them, they're available for you. I have young children, and being directed to psychologists who know what children need, that was extremely, extremely helpful. This was probably the best thing, and that my wife was able to handle this with the kids and with the help of professional psychologists. I think this has been the biggest part. There was this offer that if my family, especially my children, need in the long term any psychological support, let's say in a couple of years, and trauma resurfaces or so, there was definitely the offer extended to get support even then, even if I would not be an employee of the organization anymore by that time. I was also encouraged to go and have a medical checkup. Then I was assigned a case manager who would do all this administrative follow-up and go through with me through the list. Are you happy with the outcomes of this? Did we do everything we said we would do here? I got time off. I was receiving full pay all the time. And I was also very clearly told, hey, whatever you need, come back is the time you're going to get off. In the end, it was me who said, I want to come back to work because I feel I want to be useful again. Given this time that I don't have to stress about coming back to work within a number of months after my return. I just needed time to heal. Other people who have to look maybe for a new job, new income. I cannot imagine the stress going through that. The organization is pretty good at crisis follow-up. They've always done a lessons learned exercise to figure out what should support look like. So I was confident I will be getting good support when I come out. There was absolutely no question for me. And when I was in captivity, I knew I will not be left alone. There will be many people on the case that will try to resolve it. And that was actually one of the things that that in hindsight was probably one of the most important things for me mentally to come out of this well, knowing that my family will be taken care of as much as is possible, and that I will not be left alone, and they will try everything to get me out. What really helped me was that my employer investigating what they can do to avoid this from happening in the future. I think this was probably for me one of the most important things. If that would not have happened, I think I would have stayed behind with a lot of anger and resentment. Another thing that really touched me deeply was that my employer was making sure there is an email address for friends and colleagues who can just write messages of support to my family, but also for me when I was coming back. I was being given literally like a book that was produced at the end. It was extremely touching. I'm super grateful to everyone's messages. I imagine if you're working for an organization, not having these procedures in place and not having this contingency planning in place can be extremely detrimental, because people notice what is happening, and if people see that that the support is not good, people may also turn away from an organization. It had a very positive effect on my colleagues, that they felt, we're still working every day in dangerous places, but we feel the organization is watching your back, and they take it seriously to make sure you're okay when you come out.
Much gratitude for that person sharing his story. And I don't know if it's getting you guys, but the first time I heard that story, just waiting for him to say what wasn't working well, and it never came. When I was editing this video down from a half-hour conversation to those 4 minutes, every other sentence was actually the most important thing was this, the best thing was this. It was just a list of what good looks like, and it's encouraging to me and to others that this is possible, and it's worth going for and fighting for and working towards. The panel discussion, Imogen and Christine, I think laid out a lot of the gaps in this type of environment, the landscape, the knowledge, skills, the resourcing, and the motivation in the organizations to do everything to increase the odds of a positive recovery. It's complicated. For the individual, same sort of things. There's knowledge and skills and attitude. I wouldn't say there's a motivational block. I've never met anyone who didn't want to get better, but it's a persistence to push through every obstacle that comes at them and blocks them, every letter that says you don't fit in a policy, every manager that is afraid of saying, "How are you?" will lead to a lawsuit. And I can assure everyone on this page, you need more than just a manager asked me one time, "How are you?" Therefore, liability happens. So it's complicated. Lay on top of that some fears, some bias. Maybe there's a language issue. Also, the person who's been highly traumatized has been highly traumatized, and they might not be able to take on a project at that point, the project of their recovery. So where to from here? I hope we've sufficiently scared the hell out of people on what. Oops, has that shared? Oops, I'm going to share again. Shared that it's complicated. It's very difficult and complicated, but we can do some things here. So for the last 9 years, since the court case, yeah, people have come to me asking, and I've seen patterns and I've seen opportunities of how to get involved. So here's what I've come up with: proper support, recovery consultancy. It's about casework, firstly. And this isn't working. Casework. This is when people come to me with a grievance or an injury, they're lost in their recovery, working with them to identify their goals, working with them to talk about what could lie ahead on the road, and then being a project manager to take incremental steps there. I don't do this alone. I work with a group of people that is growing. These are psychotherapists and medical doctors and lawyers that can help navigate this person to their closure. Secondly, taking the lessons from that, I work with organizations on training or policies or other elements to improve the behavior, because I do agree, it's with Imogen, it's a lot of those nuances in the wording of and the attitude towards people that are injured. I remember in my situation after I came out, there was an instruction, don't talk with him so that he can heal. And I felt like the loneliest person ever. It's getting some of the lessons back to the implementers is important. And lastly, advocacy. The advocacy element, that's where the change can happen. Establishing legal precedent, as it's been well talked about here and throughout the industry, that case, I think, made more of a difference to the industry than my incident by far, but also trying to not go to legal as a first resort, but rather pushing the best practices, getting the tools out there. Just to give a little indication of where I'm at with clients and where the team is. With the team, we've had 48 clients, just under 50 here. This is a spread of the incident types and the places where they've occurred. It's just an indication that it's a complicated landscape. I'm not trying to set up the safety net for the world's aid workers, but I am trying to highlight the gaps of duty of care post-incident. Moving on to another gap is people that are burnt out, unemployed because of an injury, can't afford services. So thus in this year, I registered the nonprofit Proper Support Trust. Lisa is a trustee. We've got one other trustee in Canada. And with this, we're trying to promote pro bono services. The services I've been doing are more than 85% pro bono by start. So yeah, there's not really a shift in the operation. It's more of a shift in how we're advertising things, making it clear that this is a pro bono stream, because people with the world stress on their shoulders shouldn't have finances as one more stress. And then also, sorry, a support fund. Sometimes there's just hard costs that have to be gotten around. The translation of a legal document or court fees, or sometimes an organization is delaying the fees to pay a psychotherapist, and the person needs a psychotherapist right away to stabilize, be able to be functioning in their hometown and feeling safe. Some of the advocacy, I'm taking every opportunity to be active out there promoting this message. These are some recent blogs and conferences and other things, a podcast that just came out on whistleblowing. As well, besides all of these things, the actions that one can do oneself with a team, I definitely do not work alone here. Highlighting what other people do is vital to this mission as well. So this year I had the pleasure with Lisa as well and 3 other people. We've registered the nonprofit Duty of Care Alliance. It's a nonprofit entity as well, and here we are. We want to promote robust duty of care practice, and this is by amplifying other initiatives. We know there's a lot of initiatives starting up and going. We want to find a way to amplify what they're doing and getting out good practice, highlighting great gold examples like the former hostage who talked about things, but also to highlight bad case scenarios and to support people in their advocacy about their cases. So please register. It's early days with this initiative, but the website's there, dutyofcarealliance.com, and yeah, register and we'll get some updates to you. Also, if you're in Geneva at the end of October, we've got a booth there, and we'll be at the Duty of Care Pavilion at 8X. I want to pause for a second and just leveraging on this to introduce someone I met 4 years ago. We were both passionate about doing more for an organization. We both had our hats in the ring to apply for a board position in a large NGO in Canada. He has inspired me in his personal experience in Chad and noticing that he was underprepared for the stressors that came up, and also he can do something about it. So I'd like to introduce Idriss Lomba. His bio will be coming out in the chat shortly. He is a co-founder of eCare Anywhere. It's an initiative to bring better support to people. I'd like to leave it to him to talk about it more, but Idriss, let's get you off mic and off mute and talking. Yeah, here we go.
Thank you, Steve. Thank you very much for this introduction. Hello, everyone. Wow, Steve, as you were speaking and as I heard your mom speaking earlier, I kept saying it is unfortunate what you went through, but at the same time, we wouldn't be here if if we didn't go through the experiences that we went through. I know that traveling and leaving Canada or leaving your home country to go anywhere is a transformative experience. It always is. In this case, in the settings that we go to, that transformation is too often, not the way we're hoping. By the end, it will come back to be. Like you said, we want to come back safely, but too many come back not feeling that way anymore. Even when we don't see it, sometimes it's not even obvious. It's not physically obvious. We don't hear the stories, but obviously we come transformed. So eCare Anywhere, in 2020, we decided to fund this organization to address a gap in how humanitarian organizations support their staff overseas. The journey has not been easy because, as you know, many organizations tend to set up their own internal system to sort of address these gaps. But one thing we knew for sure is people hear and listen and connect with different people based on the voice, based on the experience, based on the tonality. There are people that, Steve, you're able to connect with, who are able to share the story with you because they're related to you. So the more people can talk about or create solutions, the better it will be for all us all. So it's about sharing our experiences so that people can, the humanitarian workers can find a place where they can have intimate conversation, where they can feel heard. And that's all we do. We want to add to those voices. We want to bring yet another solution in place. Our approach is to collaborate with NGOs and identify these gaps, and come up with a support plan. That's really the approach. It's a collaborative effort. When we started by discussing and having conversation with humanitarian workers themselves to fully understand what they went through, what could have been different, what could have been better. So it's from that place where we started. And then we opened up to international organization working abroad. And that has, as I mentioned, the journey has not been easy because obviously international organizations have those mechanisms that they're building. So we decided to switch the approach and connect with Canadian grassroots or root organization. One in particular that I remember vividly is an organization that works with people who are incarcerated in Canada, who are in prison. So they hire people and send them to prison to provide support. So those employees who go to the settings often come back with their own traumas. They see and hear stories. So we started working with them to see if we can build a model and then use that model then to go and have conversation with international organization again. So it's been a gradual, slow growth, but we're making that progress. And more we're seeing that organization are opening up to us. Insurance companies are even interested in our model today. So it's a beautiful place to be. Again, something good can come out of a traumatic experience for other people, but we do need to continue to build. And so for the next 5 years, we want to continue to work with these NGOs to optimize these health strategies that they have in place, to share what we're learning with them so that they can improve on the strategy, to build systems that will allow for the staff to have better training and to access the SOPs, the standard operating systems and processes, via the phone. So it's easily and readily accessible to them. So we are building that technology as well. I feel privileged and that I have been in this position where I was able to be exposed to leaders in the NGO sectors and also the staff like myself who went through so much so that we together can build a solution. I'll pass it on back to you, Steve, and I'm here for questions, but thank you to you all for building this solution. This is how we do it. We need to multiply and amplify the voices and efforts, and we're doing just that. Go ahead, Steve.
Thank you. The contact details for eCare Anywhere will be at the end. Thank you very much for that. Moving on, I'm trying to be quick to get us to the hour and get everyone free. We're looking for people to join the proper support movement. This is my call to action. We've got a number of different ways that we're building a network of professionals and supporters. Firstly, the expert network. These are people like doctors, lawyers, psychotherapists. If I can give one example of how it was successful recently, a case came in, there was a medical complication. Within a day, I was able to get a doctor who could look at the documents and say, this is important, there's something here, and here's the specialist needed to get into this deep and specific. Within a week, we got a specialist on this to look at it, and absolutely there was a problem. And then within a month, we got a third specialist who was able to review all the documents and get a full report out, which is hopefully going to push the process along. But that type of support would cost a lot and take a lot of time to buy that service along with a cold door being shut along the way. It's complicated jurisdiction and so forth. Lawyers and psychotherapists and insurance people onward, we need a lot of people. Also, money is unfortunately the obstacle that keeps coming up. When we look at all the resources that we need, money keeps coming up as something that blocks. We're looking for monthly donors. We're looking for one-off donors, people who want to support the mission that don't have the time or the skills to be involved. Lastly, stay informed about proper support. This is not just this company, but it's about the idea that people post-incident, that's not where the story ends. That's not the end of the newspaper for them. There's a story there, and they need to be supported throughout. So be involved with that. If it's a peer, if it's somebody you're managing, somebody that manages you, support can go any way. Family members for sure as well. Okay, I'm leaving it there. We've got one more video.
Hi, my name is Sarah Giles. I'm a Canadian ER physician and a former humanitarian doctor. In October of 2020, I found myself in a very dark spot. I had been battling a major NGO for 15 months and had gotten precisely nowhere. I couldn't see a way forward. I felt like I was trapped in this crazy labyrinth of anger and bureaucracy that didn't care about me and didn't care about people I had worked with. A friend recommended that I get in touch with the folks behind Proper Support, and that was a major turning point in not just my battle with the NGO, but within my life. They helped me navigate the situation. They were the buffer between me and the NGO and me. They made sure that my needs came first. I finally got to a place where I think both the NGO and I found that we had some common ground and could agree on steps forward. I felt at that point like I could move on with my life. I was so thankful for the support that I had received that I began to volunteer with Proper Support in a very small way. I would review cases with them, looking to make sure that their clients got the medical care they needed, and to look and see if there was some merit in pursuing claims over some injuries. The work that Proper Support does is essential. I cannot tell you the difference it made in my life to have a dedicated, skilled, and independent team in my corner. I never felt like I was alone. I believe in the work that Proper Support does. So much so that I'm willing to match any donations in the next 6 months up to a total of $5,000. I want to make sure that people in the situation that I was in or similarly never feel alone. Proper Support, thank you so much for your help over the years, and I wish you all the best moving forward.
I think looking at the time, there's a lot I could say. I think we've covered so much ground in the time, but I think it's all of these have really highlighted the need for greater expertise within organizations linked with that personalized individual support available for the individuals. And I think Sarah wrapped it up very nicely. So I would like to thank Christine and Imogen and Idriss. It has been great that you've been able to join us this afternoon. My thanks to Steve for the work that he is doing with this, for what he's done in the past, and the changes that continue to make and want to make to get good practice within the sector. We'll just close down now the formal webinar. There will be a slide put up with all of the contact details on there should you want to get in touch. If you can stay and you'd like to stay around for a chat and a Q&A, please do so. But at that, I would just like to say thank you to all of you for attending, for joining us. Thank you for everybody who has contributed. I'll ask Megan to turn off the recording and to put up the slide. We'll let everybody go who needs to go, and hopefully some of you will stay around for a chat. Thank you very much, everybody.
Proper Support Recovery Consulting has 3 main activities. Those are casework, learning, and advocacy. Proper Support Trust allows pro bono access to these 3 activities. Proper Support Recovery Consulting is a partner of the Duty of Care Alliance to promote robust duty of care practice and to amplify duty of care initiatives. To find out more or to join our network, please visit propersupport.ca. Thank you.